Hello, everyone. Welcome to today's lesson with calebmulonga. Before we go into our video, hit the subscribe button and don't forget to comment if you have any questions or things that you would like to see. Today, we are looking at medical management of asthma. So we have been looking at asthma and we have looked at the signs and symptoms, the pathophysiology, and others. So today we are looking at the medical management. What are we going to do in terms of medical management? So without wasting much of our time, let's go ahead. So in medical management, the first thing that we do is find the diagnosis. How do we come up with the diagnosis? We come up with the diagnosis through our investigations. So these are the investigations that we can run to confirm that this is asthma. Firstly, we have history taking. When we say history taking, we're basically asking the patient about any allergens or allergies that they have in the past or they still have. So history taking will review exposure to specific allergens or irritants. So the patient might say, no, I'm allergic to perfume. No, I'm allergic to this particular substance, this particular stimuli or stimulus. Number two, we have physical examination. So physical examination, the patient will present with wheezing sounds during expiration. So while they are breathing out, the patient will present with the wheezing sounds. So those are the first two. Then we're also going to look at the laboratory tests and also the radiological tests. So we have what we call the lung function test. The lung function test is used to establish a degree of impairment, degree of obstruction, and its reversibility, and also to establish baseline ventilator functions. So basically what we're saying is that this lung function test will help to establish the degree of impairment and also the degree of obstruction. Number four, we have some specimen for culture and sensitivity to rule out presence of bacterial infections. We also have chest X-ray. Chest X-ray will show possible hyperinflation where areas of focal atelectasis. So we find that this X-ray will show possible areas of hyperinflation. We also have skin sensitivity tests, which are done to identify allergens or other triggers responsible for the onset of asthmatic symptoms. That is what we call skin sensitivity tests. We also have what we call the arterial blood gas analysis, the ABGs, arterial blood gas analysis. So these are basically obtained to identify the presence of mild to severe hypoxemia. So to note if we have sufficient oxygen in the blood or not. So basically those are the investigations that we can put up. Then after we have confirmed that this is asthma, then we are going to treat this condition with drugs. So what drugs do we have that we can treat with? Okay, so we are going to start with the first one, which we call the bronchodilators. Under the bronchodilators, we will mention about two drugs. So the first drug that we are going to talk about is called salbutamol. Salbutamol. So salbutamol, usually the dosage the presentation can either be a nebulizer or an oral drug, oral tablets. So the dosage is either nebulizer or orally 2 milligrams TDS. The mechanism of action is that they selectively stimulate beta receptors producing bronchodilation. So what these drugs do is they are going to stimulate the beta receptors in the walls of the bronchi or the airway, therefore produce bronchodilation. Side effects include tachycardia, blood pressure changes, nervousness, nausea, vomiting, insomnia, headache, among others, palpitations, etc. The nursing implications include should not be used in patients with angina or cardiac disorders, should not be used in patients with angina or cardiac disorders. Number 2, encourage the patient to take the drug even when feeling well. So we have to encourage the patient as long as they are on this treatment to take the drug even when they are feeling well. The second drug that we have is aminophylline. Aminophylline. Dosage, so it is a bronchodilator. Dosage, usually in the acute stage, we have the maintenance, the loading and the maintenance dose. We usually give 5 milligrams per kg body weight intravenously as a loading dose over 20 to 30 minutes. And then we later on give a maintenance dose, which can span, which is usually 250 to 500 milligrams over an extended period of time. That is basically 5 milligrams per kg body weight. So usually it is 5 milligrams per kg body weight given over 8 to 12 hours as a maintenance dose. Mechanism of action, it is basically the same. What it does is it relaxes the bronchosmooth muscles and improves contractility of the fatigued diaphragm. So what it's going to do is improve the relaxation of the bronchosmooth muscles, which is basically dilation of the airway, and also improve the contractility of the fatigued diaphragm. Side effects include tachycardia, nausea, headache, insomnia, and arrhythmias, among others. Nursing implications, instruct the patient to lay down if they experience dizziness. So you find that this drug has a side effects of dizziness. Therefore, you advise the patient to lie down when they have dizziness. So those are the two drugs that we can talk about under the bronchodilators. After that, we can talk about the corticosteroids. So under the corticosteroids, we are going to talk about a drug called prednisolone. Prednisolone. Under the corticosteroids, we also have other drugs such as we also have other drugs such as hydrocortisone in the corticosteroids. So, but we are going to concentrate on prednisolone. So dosage is 5 milligrams to 10 milligrams per day per oral, or 15 milligrams per oral on alternating days. But usually we just say 5 milligrams to 10 milligrams once a day per oral. Mechanism of action is that it has anti-inflammatory and immunosuppressive effects. Basically, the mechanism of action is that it decreases edema in the bronchial airway, thus decreasing mucus secretion. So it decreases edema in the airway, thus decreasing mucus secretion. Side effects. Side effects include skin changes, osteoporosis, which is soft bones or holes in bones in the bone. Also have increased appetite, obesity, immunosuppression. It reduces or lowers the immune system. It also has side effects such as muscle weakness. Nursing implications. Nursing implications include advise patient to take drug on alternative days as it reduces side effects. So in the 15 milligrams dosage, you find that we usually advise the patient to skip a day so that it can reduce side effects. Number 2, drug should be taken with food or milk in the monitoring as it causes peptic ulcers. So this drug should be taken with food or milk in the morning mostly, as it causes peptic ulcers. So that is basically it about corticosteroids. And lastly, we have antibiotics. So this condition can come as a result of an infection, respiratory tract infection. Therefore, we can give an antibiotic such as amoxicillin. The dosage is 500 milligrams TDS for 5 to 7 days. Remember, amoxicillin is an antibiotic that belongs to a class called penicillins. So penicillins are usually bactericidal in nature. So even the mechanism of action, it is bactericidal, meaning that it inhibits the synthesis of the bacterial cell wall, leading to the death of the cell. So it is bactericidal in nature. Side effects include rash and diarrhea, among others. There is also nausea, there's also vomiting among the side effects. The nursing implication is assess your patient for rash and anaphylaxis. So we have to assess the patient for hypersensitivity to the drug. That is why we are saying there can be anaphylaxis and even rash. Okay, they can react to the drug. Basically, that is what we are saying. So as we know, we have come to the end of our video today. Thank you for watching. Don't forget to subscribe and hit the like button. You can watch and check out other videos on asthma and other educational videos that we have put up. Thank you for watching. God bless you.